I am a consultant hematologist. I specialize in the diagnosis and treatment of blood and bone marrow disorders. The aim of this short film is to provide some basic information about high-grade lymphoma to newly diagnosed patients. A new diagnosis of lymphoma can be overwhelming, and it can be hard to take in all the information given at the first consultation. This short film will hopefully give you the core facts about what is high-grade or aggressive lymphoma, the symptoms and signs associated with high-grade lymphoma, the tests and investigations required for the diagnosis and assessment, and the treatment of high-grade lymphoma. In the end, I will also give you some advice on living with high-grade lymphoma. The commonest type of high-grade lymphoma is diffuse large B-cell lymphoma. This is caused by abnormal aggressive B lymphocytes. The discussion in this film is focused on diffuse large B-cell type of aggressive lymphoma. I hope that following the discussion of these important points, you will be empowered with a better understanding of high-grade lymphoma. This, together with a close relationship between you and your treatment team, will make things clearer to you and your loved ones. Lymphocytes are a type of blood cell that are normally found in the blood, lymph glands, and bone marrow. These cells play a vital role in the body's defense against infections. In lymphoma, a group of lymphocytes become abnormal and cancerous and expand abnormally, causing swelling of lymph glands. Lymphoma, therefore, is a cancer of the lymph glands. There are different types of lymphoma. Some grow slowly, while others grow rapidly. Based on the growth pattern of the lymphoma cells, we call them low-grade lymphomas or high-grade lymphomas. This can be recognized and confirmed on analysis of a lymph node biopsy. Lymph glands are found all over the body, and lymphoma, therefore, can affect more than one group of lymph glands. The abnormal lymphocytes can in some cases also spread to other organs like the spleen. The abnormal lymphocytes can also involve and crowd the bone marrow, hindering the normal growth of other cells in the bone marrow. This then can cause anemia or low platelets or low white cell count. High-grade lymphomas mostly present as a swelling or a lump. This may be due to an enlarged lymph gland or a cluster of lymph glands. Sometimes these can be uncomfortable. In some patients, the spleen may be involved in addition to the lymph glands. In a minority of patients, lymphoma may involve other organs and cause symptoms and signs associated with that particular organ. Some patients may also experience other symptoms like unexplained weight loss, fevers, excessive night sweats, or unexplained itching. If any of these symptoms are present in lymphoma patients, they are referred to as B symptoms. The B symptoms are a sign of disease progression and therefore are important. A CT scan of chest, abdomen, and pelvis, sometimes including the neck as well, is required to assess for number and size of the enlarged lymph glands. A lymph gland biopsy is then required to make the diagnosis. This involves removal of a piece of or the whole of the enlarged lymph gland, which is then analyzed using a microscope and other techniques. You will also require additional investigations like blood tests, X-rays, assessment of your heart function, and a bone marrow biopsy. The bone marrow biopsy is an investigation where a sample of the marrow is obtained from the hip bone. This is done under local anesthetic and is quite well tolerated by most patients. These investigations help your doctor to understand the extent of your disease and how fit you are for chemotherapy. Special scans like PET scan may be required in some cases. Depending on the extent of the lymphoma, we can assign a stage from 1 to 4 to your lymphoma. Stage 1 represents limited disease, while Stage 4 represents more widespread disease. The treatment for high-grade lymphoma is with chemotherapy. The specific type of chemotherapy used depends on the exact diagnosis based on the lymph gland biopsy, as well as on patient's fitness and presence of other illnesses, if any. The details of your chemotherapy and its side effects will be provided to you by your team. Modern chemotherapy is done in specialist units, which are very good at safe delivery of treatment as day cases. This means you can return home the same day after the chemotherapy. You will be given additional medications to manage and reduce the side effects of the chemotherapy drugs. It is important that you drink plenty of fluids while you are receiving chemotherapy. One of the common side effects of the chemotherapy is weakening of the immune system, leading to a risk of recurrent and severe infections. This will require you to be vigilant of any symptoms of ill health and seeking urgent advice from a doctor if you are unwell. The infections, when treated in a timely manner, respond very well to appropriate antibiotics. For this, intravenous antibiotics may be required, which means you may need to be admitted to the hospital for a few days. The chemotherapy is given every few weeks, but the exact pattern will depend on the specific chemotherapy being used. The total number of chemotherapy cycles will be decided by your doctor based on the findings of your investigations for lymphoma. For most patients, the chemotherapy continues over a period of 3 to 5 months. In some cases, radiotherapy may be considered as an additional treatment. This will be decided by your team based on the characteristics of your disease. Diffuse large B-cell lymphoma responds well to treatment in majority of patients, and up to 60% of patients will be cured just by the first line of chemotherapy. If the disease comes back, it can be treated with further chemotherapy, including stem cell transplant. You will be followed up by your hematologist on a regular basis, even after the chemotherapy is complete. If there are any symptoms or signs of return of lymphoma, then further investigations and treatment will be organized by your team. It is therefore important that if you notice any lumps or swellings, you should make contact with your hematology team. But remember, the modern chemotherapy for diffuse large B-cell lymphoma is quite effective, and the overall outlook is promising.